Astrid.
Alright, so imagine your liver, your heart, or your kidney failing. Imagine having to die because one of your organs isn't functional anymore. Today, we are able to do organ transplants to save your life. So I will be talking about human organ transplants. Every day, someone's life is at risk because of an organ failure. Every day, someone's life is saved because of a transplant. As my mother was once waiting for a kidney transplant, I feel credible to talk about this topic. So first I will discuss the first few successful transplants, then I will talk about the type of transplants that you're able to have, and then I will talk about the transplants that have done in the 21st century. So let's get started. The first successful transplant ever was a kidney transplant between two twin brothers. The lead surgeon was Dr. Joseph Murray. He performed the surgery on December 23rd, 1954. It was in the city of Boston. Since the brothers were twins, it wasn't really a difference of the body rejecting the kidney, since they were so much alike. So now that you know of the first organ transplant, now I'm going to discuss of the first heart surgery transplant. The first heart surgery was performed by Dr. Christian Barnard in Cape Town, Africa. The surgery was performed on December 3rd, 1967. It was the guy that needed a new heart was Louis Wassafa. According to South African's History Online, the donor was Denise Darvell, and she was declared brain dead after a car accident. However, Louis wasn't able to, he didn't survive. He died 18 days after because of a lung infection. Now that you know a little bit of the first successful heart organ transplants, I'm going to move on to talk about the type of transplants that you are able to proceed. So let's talk about the type of transplants. Today, while you're alive, you're able to do a liver transplant, a kidney transplant, and you could do skin transplant. You're also able to do bone marrow transplant, and you're also able to do blood transplant, but that's not really an organ. However, if in order to do these type of transplants, you do have to meet some type of criteria, so the person receiving the organ doesn't reject it. However, when you do die, you're able to do donate your heart, your pancreas. You're able to donate your eye tissue and your lungs. You could also donate nerves. You could also donate your bones and other stuff, other type of transplants. So now that you know a little bit about what type of organs you're able to do, I'm going to discuss about transplants that have been done in the 21st century and how medicine has modified and has changed a lot to do these type of transplants. So I'm going to go on and talk about facial transplants that have done. The first facial transplant was done in Amiens, France, and it was the first facial transplant in 2005. According to Lawrence K. Altman in Daily News, the woman The lead surgeon was Dr. Bernard de Vallejo, and the recipient was a 38-year-old woman that was attacked by a dog. Now, on March 20, 2010 was the actual first whole facial transplant, and it was done in Spain. And the lead surgeon was Dr. Joan Barrett. According to Daily News report, the man was injured in a shooting. However, he did need a lot of physical therapy to regain 90% of his whole facial function. Now that you know a little bit about organ transplant and facial transplants and the type of transplants that can be done, learning about how transplants is an easy way of how to save a person's life. So I talked about the first few organ transplants. I talked about the type of organ transplants you're able to do, and transplants that can be done now with advanced medicine. With that said, I leave you with the statistics of the organ donation. So according to organdonors.gov, 60% of living donors are women, 38% are men, but it's the opposite when it comes to disease donation, which is 40% of women and 60% of